Welcome to the Hurley Healthy Living Series, Caregiving 101. What we're going to talk about today is the idea that our bodies are meant to move, and they're meant to move our entire lives. And no matter what our shape or size, we are supposed to maintain our baseline mobility and make sure that we keep being mobile all through our lives, despite the kinds of things that happen to us, like health changes, aging, all of those normal things that occur. So what we want to talk about today is how often people don't go get training to help keep everyone safe and moving as they go through their lives together. So people end up at home helping someone that they haven't prepared or educated themselves to help. And that can lead to a lot of problems. It can lead to the person that they're helping getting hurt. It can lead to them getting hurt. And it can also lead to people having to move out of their homes or seek their home being somewhere else without wanting that. And what we want to talk about today are some of the techniques that you can use and train yourself on to make sure that you're able to help your loved one at home or the person that you're supporting at home, and you have all of the choices that you would like to have.
Thank you, Tristram. This is going to be a super helpful event for any caregiver, whether you are new at helping a loved one or you've been doing it for a while. If you have questions for our experts, please text me at 248-935-2562. Make sure it's a text, not a phone call. Now, you can also post your questions right in the comments on Facebook and on YouTube. Hurley Senior Center of Excellence is a leader in this region for innovations in senior care and advancements for seniors with respectful care that they deserve. And we are super excited to be able to share some of our expertise with you today. So let's get to it. Walking us through the demonstrations today is Tristram Cumming, Director of Care Coordination and Clinical Risk Management. Tristram has worked in a hospital and rehabilitation setting her entire career, seeing how caregivers struggle. Stacey Abraham is a geriatric nurse specialist. Yes, we have many caregivers who are specially trained to not only care for seniors, but to care for them with dignity. Stacey has worked with seniors her whole career. Now, both of them are passionate about teaching and supporting you so you can live your best life and so seniors can feel independent. Let's get to those demonstrations.
We've got a loved one in the bed. Her name's Sharon, and we're going to have Stacey help her get out of bed today. Normally, when you're thinking about the way that your body moves around in a bed, you might not think about all of the small adjustments that you need to do with your muscles in order to move around in that bed easily and get yourself out of it. However, especially if your bed's a little bit softer, that can really be a challenge. So we're going to start by showing you how to help Sharon roll to the side and then sit up in the bed, easily and safely. So the first thing we're going to do is talk about how to help someone get out of bed. If you think about the way that your body normally moves around in a bed, it's really important to think about how often you make little muscle movements to help move around your mattress and adjust yourself. It's not even something that you think about, but when you don't have the ability to do it, it will help you get stuck in a bed. So we're going to show you right now how to help Sharon get to the edge of the bed and sit up. And we're going to start with her lying down. So the first thing that we're going to do is we're going to have Stacey ask Sharon if she's able to lift the knee, scoot the knee up from the leg that's further away from Stacey.
Are you able to lift this knee up? No. Okay.
Then Stacey can do it for her. And that she's going to be careful as she's doing it that she's bending at her knees and not lifting at her waist, even though it's only a small amount of weight. We want to make sure that she's being safe with her body just like she's being safe with Sharon's body. So she moves her leg up so that her foot is flat against the mattress and she has her hand on her knee. The important thing about that hand on the knee is that sometimes if people can't move their own legs easily, they also can't hold them in place easily. So if Stacy doesn't keep a hand on that knee, it could flop over and it could hurt Sharon. So she's keeping her hand on her knee for safety the whole time. If Sharon can move her own leg, it's not as important. The next thing she's going to do is ask Sharon to reach across the front of her with her arm that's further away, her left arm.
Left arm, and reach over here, and your head.
And then she's going to ask her to turn her head in the direction she's going or towards Stacy. At that point, Stacy can take her other hand to the back of Sharon's shoulder and pull toward her and push down on her knee at the same time so Sharon rolls like a log. So now Sharon's rolled over, and if Stacy wants to sit her up, she's going to ask her to move her right leg toward the edge of the bed.
Can you move this right leg towards the edge of the bed? Good.
And then she's going to help her or ask her to move her left leg so that both of her legs are scooting off the edge of the bed. At that point, Stacy's going to make sure that she's able to support Sharon's other shoulder, the shoulder that's toward the bed, and ask Sharon to put some weight on her right elbow if she's able. And Stacy will make sure that she's pulling her thighs toward her and pop her up by pushing up on her shoulder.
Some weight on that elbow there. Good. How do you feel? Good, good.
So then we can just take an adjustment and see if she's in a good position for sitting. I think she looks a little bit crooked, so it's very easy to make adjustments at the point of sitting up. A lot of times things don't happen perfectly and you make adjustments at that point. So in order to get her even so that her feet would be able to head toward the floor, Stacy could either ask her to scoot her hip forward or pull gently on her thigh.
Can you move your hips forward? Good.
Nice. The next thing that we're going to do is talk about something called a gait belt. Stacy's holding a gait belt right now, and this is something that you can get at over-the-counter at a drugstore, over-the-counter at a medical supply store, at a Meijer, at a Walmart, almost anywhere like that will have something called a gait belt. You can also order one from a medical supply company. I think they even have them on Amazon. They come in cloth, they come in plastic, they come in all sorts of different things. The different options that you might find for a gait belt, I have a cloth one right here, and the thing that's important to know about this gait belt is that when you have a professional gait belt, it's going to have teeth. These little teeth are what will keep that tight when you put it on correctly. So you would slide the end in and then through the other belt so that when you pull, the teeth keep it tight and they don't let it slide open. Now that we've talked about a real gait belt, let's talk about how important it is to always consider the tools that you have as options, because a lot of things can be used for the things we need that aren't the same thing as a real gait belt. One of the things that we really like to promote is a simple pair of pajama pants. So this is a pair of pajama pants, very, very sturdy, that can go around a patient and it can tie, or your loved one. It can tie in a double knot. A single tie doesn't usually work because it won't be tight enough, but cloth doesn't pull in knots so tight that you can't get the double knot undone. So you want to do the double knot, so it's the same type of thing. Another option, sometimes people are a little bit rounder like myself, and you might need something a little bigger than a standard belt or something just a little more giving. So you could use something that has a little bit of give to it. And you can use a bottom sheet for this sometimes, especially if you have those jersey sheets that have a little bit of give. And these can do the same thing the pajama pants did. You just have a little more room and a little more stretch. So it would go around the person and it would tie in a double knot. So I just wanted to tell you about some different options for gait belts so that you knew all of the things that might be available to help keep someone safe when you're moving them. The purpose of a gait belt, the word gait is a word that means walk, so it's a nice safety thing for walking, but it's actually a nice safety thing for any kind of moving. And the purpose of that gait belt is going to be so that Stacy, or you, if you're helping your loved one at home, doesn't have to use the person's body in order to have a handle. A lot of times we see people helping people moving other people by lifting under their arms, by grabbing them around their waists. Those are both things, all of those kinds of techniques where you're using another person's limb or part of their body can be really dangerous. So we encourage you all the time, if your person has anything that is a mobility constraint, to use a gait belt as your handle. And as Stacy's demonstrating, you'll be able to see how that works. So Stacy's putting the gait belt on Sharon before they go to get up. She may need to readjust it after they get to standing, because sometimes you tighten a gait belt more loosely when a person is sitting and then have to adjust it a little tighter when they stand up. It's important to make that adjustment because a gait belt should fit exactly as tightly as you being able to fit your fingers underneath it, and no more loosely than that. One of the bigger errors that we see related to gait belts is putting them on too loosely, so make sure it's nice and tight. Stacy and Sharon are going to get from the bed to a chair. We talked about how to sit up safely, and now we're going to talk about how to move from the bed to the chair safely. The first important thing to do is make sure that everything and everyone is prepared for what's going to happen, which means that Stacy would have told Sharon what's happening, Sharon would be on board with what's happening, and we would make sure that the chair that Stacy wanted to get her into was where Stacy wanted it. Make sure that her feet are flat on the floor and that they have something non-skid on them. It can be a good house shoe, it could be a slipper with non-skid on the bottom, or it could be some sort of tennis shoe or sport shoe. Anything with a nice rubber sole should be fine. The important thing to do is make sure that we're not using the type of slippers or house shoes that are slippy. Those are dangerous. Those make it more dangerous instead of less. So she will have her feet flat on the floor with non-skid on the bottom. And then she's going to make sure that Sharon is comfortable leaning forward. Stacy's putting her hands on either side of that gait belt for handles so that she can safely make sure she's got Sharon supported for this move. Please make sure to know that this is where people make the biggest mistake most often, and they grab their loved one under their arms. People's arms get weaker as they age, and that shoulder joint can get weaker, and it is really important not to grab people under their arms and lift. In some way, you've got to do it better than that, and a gait belt is a great option. So, what we like to teach people is that it can be really helpful in the preparation for moving from the bed to the chair to do a count of 3 and a rocking motion. Before she does the count of 3, she's going to ask Sharon to look toward the chair and know that's where she's going, and then they'll practice their count of 3, and she'll ask Sharon if she's able to push off the bed with her hands. If Sharon is, that's wonderful. She'll do that, and then she'll reach for the further armrest. If she can't, Stacy will move her hand to that further armrest before the move starts. I think Sharon can push off with her hands, but Stacy, go ahead and take us through that. 1,
2, 3.
Perfect. So one of the things that was really important during that move was that Stacy also kept herself safe. When Stacy moved Sharon, she used her body mechanics appropriately by making sure that her legs were the muscles that were doing the moving, and that they were far apart and wide, and that she kept herself low with a straight back. That was important for Stacy's body to stay safe. When you're helping people move at home and you don't have training, the first thing that happens is you get hurt. And then your loved one can't move around as much, and then they decline and they get sicker, and it's a terrible cascade. So this is a really good technique, and we want to make sure that you're seeing what both parties are doing. So the next thing that we were going to do was have Sharon stand up from a chair, and Stacy can help her take a walk. Sharon's going to push off from the armrests as Stacy keeps herself and her body right. They're going to stand straight up. Her feet are flat on the floor with the non-skid footwear.
1, 2, 3.
When somebody goes from sitting to standing, it's very important to take a moment and let them just be still. Some people, more people than you would expect, get a little bit dizzy when they stand up quickly. That's normal. And you just need to make sure that you respect safety and wait for Sharon's body to adjust so that she's able to move forward. While Sharon was standing and making sure that she felt safe and not dizzy, Stacy's able to make sure that that gait belt's fitting the way we would want it to for the next move, preparing for the next move, having it fit right. The next move's going to be taking a walk. So as Sharon moved forward, Stacy would keep a hand on that gait belt if she was unsure of what Sharon was able to do, or if she ever got unsteady sometimes. She would keep that gait belt held behind her as she walked next to her, but just slightly behind. Perfect. We really wanted to take a moment to briefly mention one of the biggest errors we see that leads to a lot of safety problems. People can get really hurt making this mistake, so we wanted to show what to do instead of what not to do. If Sharon needed a walker to help her move, a lot of times people make the mistake, rather than doing what Sharon's doing right now and having her hands on the armrests or on the seat of the chair to sit up, they reach up to the walker handles and attempt to pull themselves to standing with the walker. That does not work. Think about everything your body's doing to stand up from that chair. You don't pay attention to it, but the first thing you do is lean forward and push off. Sometimes you can push off with the muscles in your legs, but if you're deep in a chair or a little bit weak in the legs, you end up using your hands off the seat to push or off the armrest to push. If we reach up for the walker, all that ends up happening is we'll pull that walker and any other equipment back on top of us and get hurt. So we wanted to show you so that that's not a mistake that gets made at your house.
Oh, what happened?
I fell.
She's going to make sure that he doesn't have any bleeding anywhere. She's checking him all out. She's going to ask him if he can move his arms and legs.
Can you move your arm for me? Okay, what about your leg there? Any pain?
No.
Okay.
All right. So now that she's determined that he's safe, she's going to go ahead and ask him to lay on his back
Lay on your back for me.
and help him if he needs some help. She's going to remember her own body mechanics and keep her legs low and wide and her back straight. Now that he's laying on his back, if he can sit up by himself, she's going to ask him to.
Can you sit up?
Yes.
She can give him a boost with her arm if needed. Now he's been on the ground and she doesn't know exactly how long. So it's very important that after he's sitting, she moves behind him to give him some support and lets him sit for at least 30 seconds and probably more like a minute to make sure that he isn't dizzy and is able to do the next thing that needs to happen. If he's not, and we've waited that 30 to 60 seconds, the next thing she can do is tell him to get on his hands and knees.
Can you get on your hands and knees?
Now, if he's able, she can help him stand up, and she may need to grab a gait belt if she thinks he'll need a little help, or make one with a tool at home. So she put that gait belt on him so she's got a handle if she needs one, and she put a nice supportive something against a solid piece of furniture or a wall. We're using a chair in this case, but it could be a stool. It could be any flat, sturdy thing that Don can use to get up off that floor. So we're using a chair. The next thing Stacy's going to ask Don to do is scoot on his hands and knees around so that he's facing that chair.
Kind of crawl around and face the chair.
Now he can use his arms and stand and get on his knees, and he can just balance on the chair. Perfect. Perfect. Now, if Stacy wants, she can keep asking him to turn so that he's able to use his hands to push up off the chair into standing. And she can have her hands on that gait belt behind him. Now that he's got a chair in front of him that's very sturdy and he's supporting himself with it, he can take one of his legs and he can get onto his foot. Wonderful. Now he can support himself with his arms and attempt to do the other leg while Stacy helps balance him. Oh, beautiful. Now Stacy can help him stand and turn and sit on that chair and take a rest. She's watching his safety because he most likely will be unsteady. He took a fall. Reach back with your hands. Now we've got a situation where Don has fallen at home, and he at his baseline, and on a good day, Don lives at home and does need a lot of help. He already needs help at home, and we know that. So Stacy comes upon Don and finds him down, having fallen, and this time, since she knows that he's not going to be able to get himself up off the floor, the first thing she does is call a partner. Maybe it's a neighbor, maybe it's someone else who lives in the house, maybe it's a friend or another loved one, and the partner's going to come and help. So we still are going to assess, make sure that we don't see any open wounds or any broken bones by moving Don's body and making sure everything seems normal. Once we've determined that Don's safe, what we can do, since he's not able to move himself very easily, is we can get a bed sheet or anything like that. And what we're going to do is try to roll Don onto his back very slowly and gently. And Stacy will help his legs. And then we can roll the bed sheet just like that. So now what we've got is a way to help Don move, since we know we're not able to reach down and pick him up off the floor. We're going to use this sheet, make sure it's under his head supportively. We're going to slide him over to the wall. So we would get Don sitting up against the wall, and then I can help him move forward while Stacy gets a good handle around him. We thought this time we'd use a different option for a gait belt, And I'm keeping Don supported while Stacy's doing that. So now that Don is safely up against the wall, supported, wearing his gait belt, and we've got a good place for him to go against a sturdy background, Stacy and I will both help him bend his knees using our bodies the right way. And we will use the gait belt as a handle, and we can count to 3 and pop him into the chair. 1, 2, 3. One of the things we really want to make sure to point out is that we used what we had today. Don was wearing beautiful shoes, but there would be safer options. A rubber-soled tennis shoe would have been a little bit easier to make sure that there was no slide. If I don't have a great spot, I can always put my foot against Don's foot, and that will help because mine are rubber-bottomed. Did you know that your bathroom is the most dangerous room in your house? It's all hard surfaces and sharp edges. If you take a fall in the bathroom, it can be devastating. Let's talk about some of the things you can do to keep you safer in the bathroom. We have a nice high toilet seat. It can be very hard to get up off a low toilet. So as you begin to have mobility issues, it may be a good idea to put a taller toilet in place. You can use a shower chair to make sure that you are safe in your shower. You can sit down for some of your shower. You can use a handheld shower as opposed to trying to only be using the shower head from above. This can keep you a lot safer as well. You can make sure that there are non-skid strips or some kind of non-skid in the bottom of your shower. You can make sure that there's non-skid anywhere else on the floor. But let's go back to that privacy thing. When someone's struggling with safety, unsteadiness, mobility problems, that idea of privacy in the bathroom has to be addressed. It's very important to make sure that you understand that you can sacrifice some privacy but maintain all the dignity. It's so important to keep people safe. So just make sure that you're with them, using the gait belt that you need to use, using all of the safety tools that you need to use, and treating them with dignity and respect like they deserve.
So much great advice there. Text me at 248-935-2562 if you have any questions about anything you just saw. You can also post your questions in the comments on Facebook or on YouTube, and our experts are going to actually start answering some of your questions here live now. So the first question, what did you mean by proper body mechanics? Because I know in the video you talked a little bit about use the proper body mechanics. What does that mean?
Well, proper body mechanics just means that you are keeping your body safe as well as keeping the body that you are helping safe. In order to keep your body safe whenever you're helping another person, the 3 things to keep in mind are that you should have a wide base, which means that you should widen your legs so that you have a good support, that you should do any lifting with the muscles in your legs instead of any muscles in your back. You should never feel it in your back. And in order to do that, you have to keep, number 3, your back straight and the load that you're helping close to your body instead of far away. So the 3 things are a wide base, using your leg muscles, your big leg muscles instead of your back muscles, and then helping someone by keeping them close with a straight back.
Scott sent us this question from YouTube. He says, I took care of my late mother, Bernice. How can I take care of someone without added stress?
You want to take that one?
Sure. There's a lot of community resources out there, and that is a huge problem with caregiving. Caregiver stress syndrome is very real. There are tons of resources, depending on what county that you live in, that can help you with that. I would suggest that you call an area agency on aging, whatever county that you're in, and they can better advise you.
Sue is asking if it's best to move the walker out of the way before trying to help her mother up to standing position from a chair. She says her mom insists on holding on to the walker while trying to stand, but many times it just causes a problem.
Yeah, then I think Sue's got the exact right idea. If she's there helping that transfer, if you're there with your mom, 100%. If she's unable to keep herself from pulling up on that walker, you can move the walker until she stands by pushing off from the chair, and then you can move the walker back in front of her. If you're there, that's totally reasonable.
Sometimes I feel my mom can do more to help. How do I know if I'm encouraging her enough or pushing her too hard?
You want to try that one?
Yeah, I think that we've all kind of been through that if you've ever been a caregiver. One thing that you don't want to do is make them feel like they are a child. That's very, they have a lot of dignity that can be very harmful to them. You need to be encouraging and try to set up tasks that you know that she can do and focus on those first. Or you may need to arrange things in a different way so that she can do things on her own. Like for an example, if she can't stand to do dishes, sit on a stool and do dishes, just so that she can keep her routine and things that are important to her. Because once those things start going away, you're gonna see a lot of depression, and then usually that's when the older adult will start to decline drastically.
Okay, this came in to my text, and I'm not sure if this is a service that we provide or not, so you guys can let us know. But they're asking, how can I get my mom assigned to a visiting physician?
There's a visiting physician association. It should be there. They go to almost every county. I think the main one is in Troy, but they will go all over Michigan. But that's the
specific affiliation with them here, but we definitely work with them.
This might be a good time to bring in then Cathy Metz, who is the Geriatric Service Line Administrator here at Hurley, because there are so many different kinds of services for seniors that people aren't aware of. People don't realize that, here at Hurley, our innovations have been brought to this region for senior services that have never been here before, and that we actually have teams of people specially trained to make sure that seniors have that expert, compassionate care that you're expecting. So, Cathy, could you run down some of the things that, we provide, and so people know what kind of services there are?
Absolutely. Thank you, Peggy, and thank you all who are here listening today. It's great information. And ideally, our complete desire for our seniors is for you to be safe and stay out of the hospital as best you can. And we want to provide the community with that information to help you do that. But if you should need senior care and you have to come to the hospital, then you need to come to Hurley Senior Center of Excellence. Really proud of all the things our hospital is doing to provide a great experience. We've won national and state awards, a national award for our excellence in nursing care for seniors, a state award from the Michigan Hospital Association for our age-friendly status, and an award from the American College of Surgeons for our Level 3 Geriatric Emergency Department. So just really focused on providing extra layers of safety for our seniors. But some things that the community probably should know, that if you are a senior and you need the hospital and you come to our emergency room, we have a no-wait policy. You are immediately roomed because we know the things that seniors need faster attention. And then you've met Stacy, but we have geriatric nurse specialty service where it's different than your bedside nurse. It's an additional layer of oversight and eyes, just making sure that the care that you're going to need or your loved one is going to need is specifically designed and carried out for you. Lots of things, hospital elder life program, volunteers that come and play games and keep patients oriented, and just sit bedside when maybe a loved one can't, and just provide that companionship. So over and over and over, I'm just watching as this grows, and just being so proud of our hospital for always doing the right thing for seniors.
Great. Great, thank Kathy. We do have a lot of questions starting to come in. We are super happy to have Mid-Michigan Now as our partners, and one of their viewers says, my husband has difficulty getting onto his knees and weakness makes it difficult to get up from the floor. Is there alternates or?
Yeah. We knew that that was a little bit of a limited demonstration because it was someone who could get onto their knees. When a person can't get onto their knees, then we would suggest moving more with the second type of demonstration where you have another partner with you from the beginning, and helping the person in a way that you slide them back up against something on their bottom instead of encouraging them to climb onto knees that they're not able to bear weight on.
Do you guys know, Brian wants to know if there's any support groups for caregivers?
Oh yes, there's a lot of support groups. There's caregiving.com is a huge one. Again, your area agency on aging, they can give you a list of all the caregiving services. Alzheimer's of Mid-Michigan, there's one located in Flint. They can also be a good resource for you.
And Stacy, sometimes area agencies on aging and like local churches and things can arrange respite care for caregivers, right?
Correct. Genesee County has a respite care program, but the Valley Area Agency on Aging, they're usually the ones that set that up. It might not be with that company, but they are the primary person that gets those things going. So
Caregivers
Genesee
need
County has a
breaks.
grant, for sure.
So by respite care, you mean?
Just allowing the caregiver time to go shopping, the caregiver time to go to their doctor's appointments, and that's a big thing. Caregivers really don't take very good care of themselves because they're taking care of someone else. And so we really have to focus on making sure the caregiver is cared for.
And I would like to say one thing about that that's really important. The way that caregivers neglect themselves at the expense of the person that they're caring for is one of the things that leads to people not having freedoms and choices later, because then if something happens to the caregiver, the support system for the person they're taking care of isn't there anymore. So we can't encourage you hard enough to do things for yourselves and take care of yourselves.
So you shouldn't feel guilty if you, I think people feel guilty. They want to go out to dinner with their friend or to the movie and they're like, I can't leave my mom or dad. But
It is very important to prioritize yourself and your own well-being so that you can be there for another person.
Absolutely.
do you know if the respite care, because someone's asking if you need help lifting someone, is there a non-emergency service that can assist you? Is that something respite care also does or no?
No.
No, respite care is just for you to be able to leave and they come and stay with the patient. If you're referring to someone that has fallen on the floor, I don't really think there's a place that will come and do that. You do have to call an ambulance.
But that would be where I would love to plug the idea that the way to know what you're going to do in any of these situations is to think about them before that they happen. Imagine anything that could go wrong and ask yourselves, what are we going to do? And really try to think of what at least your basic outline of a plan will be, because that's where you're going to have your freedom and your choices. You have some idea of what you want to do when this thing goes wrong.
So we were talking a little bit even before we went on the air here, and you were saying you should practice.
Yeah.
It seems so like you don't want to think about your loved one ever, being on the floor, but you're saying put them on the floor so that you can practice how to get up.
Yes, we would. It's so scary to think about things going wrong that people avoid thinking about things going wrong. And when we avoid thinking about things going wrong, we're not prepared. And the way to feel comfortable and the way to feel prepared is to practice what we're going to do when we're uncomfortable and unprepared.
Cathy had talked about how we have the no wait senior emergency, which is great because you just come right in and you can get seen. But Gretchen wants to know, does she need to call ahead before bringing her father to the emergency department, or do you just come?
Great question. No, you do not need to call ahead. We don't even do that. But when you come, we immediately triage patients, and that means we check for age. And when they're 65 and older, that is an automatic known priority. And I just want to make sure I clarify too, you're immediately roomed. It doesn't mean that you're immediately seen, but the nurses are starting to care and do assessing and all of that, because a cold for a 40-year-old versus an 80-year-old is a whole different story, so we know time is of the essence. So no need to call ahead. Just know that when you get here, we're here for you.
And the main thing is you're not going to be sitting in the waiting room, you know, for an hour or whatever when you're
Because we don't need any additional exposure for our seniors either. So.
This question is, there's carpet in the bedroom and my dad's feet slip. Is there anything to put on the floor? I'm guessing they mean like if they're trying to, you know, get them to lift up.
Like slippery carpet maybe?
Yeah.
You could put not slippery carpet tiles over the slippery carpet. That would be the cheapest, easiest thing to do. They make those playmat kind of flooring as well that is very resistant for that type of thing. It would provide traction for your feet. Any other thoughts?
Or good shoes that are
Definitely,
non-slippery.
yes, definitely. If you have slippery carpet, having non-skid shoes will at least help.
I thought it was great in the video where you showed putting your foot in front of the person's foot so that it wouldn't slip out like that.
Yeah.
That was a good tip. Do we ever have to wash in the shower, or are sponge baths enough?
You should wash however you wash best.
Correct.
We can't promote heavily enough that when you're at home, you need to do what works for you in order to stay at home. So neglecting hygiene would be a really bad idea. But if it's easier and safer for you to wash at the sink instead of getting in a slippery bathtub, that is fine.
That's all the questions that we have. I think it was especially great that you guys reiterated to everyone to take care of yourself, you know. Just because you're taking care of someone else doesn't mean you can't take care of
You're
yourself.
an MVP.
Yep.
Thank you, everybody, for joining us. Coming up through the rest of the year, our Healthy Living series will be bringing you expert advice on lung health, pelvic health, back pain, and hernias. You can always see what's next on our Facebook page or at hurleymc.com. Seniors, if you want the best doctors, the best technology, and the most trained team for compassionate senior care, make sure you insist on Hurley. Have a great day, everyone.